Okay. Hello, everyone. My name is Edward Kirt Mamaradlo, and today I will be presenting on Parkinson's disease, a disorder that affects millions worldwide. And in this presentation, I'll be walking you through a clinical case. So you'll see key symptoms, what you might find in a physical exam, as well as treatment options. Let's begin with our chief complaint. The patient, in his own words, says, I've been feeling really shaky and slow when I move. Now, this brief statement would help us guide to focus on more movement related concerns, specifically the tremors in his shakiness and his slow movement. Now, our subjective. The patient is a 70-year-old male with increasing hand tremors and slow movement for the past 6 months. He reports the symptoms began gradually. The tremor is primarily in his right hand and occurs at rest. He describes it as a constant shakiness when I'm still. He states the symptoms are worse when he is tired and improve slightly with light activity. He rates the severity as a 6 out of 10. Symptoms are more noticeable in the morning and evening. Finally, there is no known trauma, no major prior illness, no recent medication changes, and no radiation. And by radiation, I mean it's not spreading from his right hand yet. Um, Next, the patient's history. His medical history says that he is currently not taking any new medication and has had no previous surgeries. Although in his family history it shows his father had developed Parkinson's disease in his early 70s and his mother developed type 2 diabetes. Now, this is pretty significant because some part of Parkinson's is hereditary, so his father having Parkinson's puts him at a greater risk of also having Parkinson's. Now, the social history. The patient is retired and lives in a one-story home with his wife. He does not smoke, but occasionally drinks. For my discussion question, I asked, what symptom below is not typically seen in early Parkinson's disease? A. Resting tremors. B. Bradykinesia, or slower reduced movement. C. Hallucinations. Or D. Muscle rigidity. I'll give you a moment to think about this. If you had chose C, you would be correct because while C can show up later in Parkinson's due to some other reason or side effects or drugs, it is not an early symptom seen in Parkinson's disease. Meanwhile, resting tremors, slow reduced movement, and muscle rigidity are symptoms seen in early Parkinson's disease. All right. Now, here's some general information on Parkinson's disease. Some other names people call it by paralysis agitans, that's the older name, idiopathic Parkinsonism, and primary Parkinsonism. Now, here are the prefix, root, and suffix or etymology of paralysis agitans. Para means abnormal, lysis means breaking down, agit means to shake, and ans is referring to. Literally, paralysis agitans means shaking paralysis. Now for the definition. Parkinson's disease is a chronic progressive movement disorder that weakens neurons in parts of the brain, causing them to be damaged and eventually die, leading to leading to slowed movement, tremors, and difficulty with everyday tasks. All right. So the damages actually occur in dopamine producing neurons in the brain, in the part of the brain called the substantia, um, forgot the last one, but it is a part of the brain. And obviously, this leads to motor and non-motor symptoms that I'll explain in the next slide. So here are the associated and typical symptoms. Parkinson's disease affects both motor and non-motor systems. Symptoms progress gradually, often starting on one side of the body and worsen over time. So the movement-based symptoms, the ones you would feel, are resting tremors, bradykinesia, slow movement, rigidity, and poor balance. Non-movement based symptoms could affect mental health issues, digestive issues, and sensory issues like touch, sight, or speaking. Also, smell. Now, the physical exam findings. Now, the physical examination is important in confirming the diagnosis, but there is not one way to diagnose Parkinson's disease. Uh, but it helps confirm it because it requires evidence of bradykinesia along with at least one of the following: tremor, rigidity, or gait impairment. Now, some typical questions asked for this would be: do your hands shake more when you're resting or moving? Are you having trouble getting up from a chair? Do you feel stiff in the morning? Have you had any falls or trouble keeping your balance? And obviously, you can see on the right some exam procedures as well as findings for patients with Parkinson's disease. So, for one of them, you could do the resting observation, have your patient rest, and are they shaking while resting? Or movement test, tell them to button up their shirt if they have a shirt or some other movement like a shuffle, and see if it's slowed or incomplete. Next, we have the non-surgical treatments. So some non-surgical treatments could um, include levodopa combined with carbidopa, and now these are drugs. So levodopa becomes dopamine in the brain. It replaces dopamine, and carbidopa helps it work longer, so it helps it so it doesn't break down. You can also use physical and occupational therapy to maintain mobility, speech therapy because it's hard to speak when your muscles don't move that well, and swallowing issues. And also, there's exercise to help slow progression. And these therapies are essential for long-term care and independence. Now, the surgical treatments. One very important surgery for Parkinson's disease would be brain stimulation or deep brain stimulation. And essentially, what happens is they implant electrodes into specific parts of the brain, and the electrodes connect to a battery-powered pulse generator implanted under the skin. And then the electrical pulses are delivered to reduce motor symptoms like tremors and rigidity. Now, deep brain stimulation doesn't cure Parkinson's, but it can significantly improve function, especially for those who don't respond well to drugs. Now, in this next slide, it is a picture of deep brain stimulation. As you can see in that bottom left area is the implant that'll be put in the second procedure, and around his brain you would see the electrodes. It's kind of like a pacemaker, but for Parkinson's disease. Now, here are my references. And finally, thank you for listening to my presentation. I hope you all have a wonderful day and I hope you learned something about Parkinson's disease.